Good morning. Thank you all for coming. I'm John Carl Casa. I'm President and CEO of the Connecticut Community Nonprofit Alliance. And, for many years, community nonprofits have come before you advocating for funding increases because levels of funding had fallen behind both inflation and the needs of the people of our state. So we were pleased when the legislature and Governor Lamont agreed in June to historic and much needed increases for community nonprofits. The state budget was signed into law on June 23rd, 3 months ago today. The first quarter of the fiscal year ends in 1 week. This means we're nearly a quarter of the way through a fiscal year in which state budget looks as healthy as it's ever been. Budget reserve fund is $3 billion. The volatility cap sent $1.6 billion to pay pension obligations. The current year surplus, when you put together the general fund surplus, operating surplus, and the volatility cap surplus, is $1.2 billion. That's the estimate right now. But while they've gotten their basic funding, nonprofits haven't received the increases appropriated for them that are necessary to retain and attract employees and that are needed to ensure the services are uninterrupted for people who depend on them. This has created many problems, and it's made it impossible for nonprofits to give raises to their employees who, in a difficult labor market, are leaving for better pay elsewhere. And when they leave, access to programs are limited for the people who need them. It's also led to criticism of some nonprofits for not settling contracts when they simply can't do so without the money that's been appropriated for them. So let me be clear, after more than a dozen years of underfunding, there are many more costs for community nonprofits than just employees. Things like rent, insurance, energy, equipment, and more. But the job market is near a crisis point, and staff shortages are, for nonprofits, a chronic problem that now has become acute. We're here today to urge state government to expedite payments to nonprofits of the funds budgeted for them, the increased funds budgeted for them. It will help people who work for them, and it'll help those who depend on their services. We have 3 providers here today who can describe for you the problems that these delays have caused. First, we'll hear from Heather Gates. Heather's the president and CEO of the Connecticut Health Resources, CHR, a statewide provider of behavioral health services.
Thank you, John Carl. Appreciate the time today. Many of you know me. I'm Heather, and I'm from Community Health Resources. We're one of Connecticut's largest behavioral health, housing, foster care, and primary care providers. We're serving over 26,000 children, families, and adults every year throughout the state. We are experiencing staffing shortages that are unprecedented, and it is a combination of the labor market, which is challenging. It's also a combination of not being able to address staff wages and salaries and benefits for a very long period of time because of the inadequate funding we've received from the state of Connecticut for more than 10 years now. That's in addition to reductions that, as a behavioral health provider, we experienced in the middle of 2015 and 16. We're having a hard time hiring staff at all levels. This is staff for residential programs. This is staff for our clinics. This is APRNs, physicians. It's really across our workforce that we're having challenges. And I would say it's an understatement to say our managers and our staff are hanging on by their fingernails. We have managers throughout the organization covering 3rd shifts in our residential programs because we cannot hire residential staff. We have 120 full and part-time positions vacant right now. That's out of a workforce of over 900. We have 44 clinician vacancies. These are masters and licensed prepared clinicians. And to give you a sense of what that means in terms of access to service in our outpatient clinics and for our crisis teams, every one of those clinicians is going to carry a caseload of about 80 to 100 people. That's 3,520 children, families, and adults who in the last 3 months have not been able to gain access to needed and life-saving behavioral health care in some instances. We desperately need the funding that has been appropriated. We were ecstatic in the spring when the legislature appropriated an unprecedented amount of money to help the human service system. And to now be sitting here 3 months later without that funding in our budgets and in the pockets of our staff is really distressing and, quite frankly, very discouraging given the work we have been doing over the last year and a half during the pandemic. We are consistently looking at whether we can keep operating programs. We are pushing appointments and outpatient out by now several weeks, and in some cases months. We have consistently been looking at whether we can keep our residential programs open because of the staffing. Positions that we'd normally maybe get 20 applicants for, we get 1 or 2, if that. And that's because people know that our salaries are not competing with places like Target and other non-human service entities. And part of the reason we cannot increase salaries is the funds have not been released. So we really urge the governor and OPM to get these funds out the door. They are life-saving for us, and importantly, they are life-saving for the people we are serving. We know it's not the whole solution. We know the labor market is still going to be tight, but these increases were hard won and fought for very long periods of time. And they are there for our staff and for the people we are serving. We're competing with other entities like hospitals, now telehealth companies, individuals going into private practice as well, nursing homes for our residential staff. And we're also competing with the state and with federally qualified health centers who have very different reimbursement structures than what we have as a behavioral health provider. So we are pretty used to begging for money that's not been appropriated, but it's not a lot of fun to be begging for money that has already been appropriated and should have been handed out as quickly as possible when the fiscal year began. So please release this funding so we can get it out to our staff and continue to do what we know how to do, which is to provide services. Thank you.
Thank you, Heather. The next speaker is Christy Scott. She's the president and CEO of Perception Programs. Perception Programs is a behavioral health and community justice provider in Eastern Connecticut. Christy.
Hi, good afternoon. I come to you to really advocate and possibly complain about the lack of release of these funds. Since the pandemic in March 2020, when we shut down our staff in our residential facilities, which serves people with co-occurring disorders and people re-entering from the prison systems, have come into work every single day, working multiple shifts, wearing masks, being at risk as our residents are not vaccinated and sometimes would engage in risky behavior, and they continue to come to work time and time again. We promised them that they would be getting these raises. They advocated for this. They wrote to their legislators. They believed in the system. And we're looking forward finally for the day that they could be paid a wage that they deserve. It's really, really hard. And I keep saying it's coming. You've done a good job. The state has listened. But now we're sitting here at the end of the third quarter and no raises. I don't even have an answer. I don't even have anything I can say except we'll continue to advocate. You know, they're heroes. They've come every day. They save lives. They work with a very difficult population. Some of them love their jobs, but have had to make other choices to go other places because they have to feed and take care of their own families. We have a few instances where people have left our facilities, our residentials, to work in places where the clients that they're serving have jobs to get paid more money. So someone left to be a supervisor at McDonald's and left their job at our DOC program. They didn't want to, but that was a choice they had to make. as again, we continue not to be able to give COLAs. We haven't received a full COLA since 2007. No other place would do business with a contractor where you didn't get a substantial COLA for that long. And we're at our point where we're wondering, can we continue to do this? And with demands of mandated vaccines, quickly mandating vaccines from some funders, there's a lot of work to be done, and we're continuing to do it without our increases. So that's our plea. Let's get this done. Oftentimes we have to turn our contracts around and our fiscal reports around within a week's time in multiple contracts at once, and we get that done, but we're not getting what we need. So thank you.
Thank you, Christy. Tracy Walker is the CEO of Journey Found. Journey Found is a provider of residential and support services for people with developmental disabilities. Tracy.
Sorry about that. Thanks, John Carl. Journey Found supports adults with intellectual disabilities in North Central and Southeastern Connecticut at 33 different locations in the community, supporting about 85 individuals. And one would think that there would be rejoicing in the world of intellectual disabilities because we have received our wage allocation. However, we don't have a lot of information on the allocation for benefits and retirement that has been set aside for providers of services in the DDS world. Due to that, we've been unable, those of us that are unionized have been unable to sign off on our contracts. And that is because the union is asking for a full package sign off on wages, healthcare, and retirement. And we don't know the figures yet on our retirement and our healthcare. The applications for that money don't go in until October 6th, that they need to be processed. So we are unlikely to have that information until the very end of October, possibly early November, depending on how many applications they receive. And yet I'm not able to close on the wages that I'm able to pay now because of the inability to bring the union to agreement without the benefits and the retirement package. My people deserve that money. They've earned that money, and I would love to give it to them today. I could have given it to them today, but I can't because I can't get the contract signed. In addition, we're also a provider with contracts to the Department of Mental Health and Addiction Services. And as you know, Heather so eloquently spoke on, we don't have any of our increase either. Yet the people working under those contracts are in the same bargaining unit as the people working in the Department of Developmental Services contracts, and I will be expected to pay the same increases to those staff as I do to the other staff in the DDS homes, which creates a huge inequity for us. Our staffing issue is no different than anyone else's. Right now, I have 45 open positions out of a total staff of 363. If I was fully staffed, that's 13% of my workforce. And what that's meant is my managers are also going in and covering shifts. I've had one situation where the staffing was down to a director, a temporary staff, and a relief staff that works for us, just on and off, 12, a double shift, go home and sleep, a double shift, go home and sleep. That's not a great situation for the people that we support. And people with intellectual disabilities need and deserve a lot of consistency. They need people in place that they know and who care about them. It's not a situation that we like, but that's where we are. And also people are leaving us as well for higher paying jobs with less responsibility, less accountability. The things that my staff have to do every day, it's not just providing them food and supervising them. I mean, they have to coordinate healthcare, they have to be med certified, they have to track behavioral data. These are people, very caring people doing a lot of work for very little pay. And for us, the pay is there, but we can't release it until I get agreement, and I can't provide an agreement until I know what I'm getting from the state for the benefits that are related in that pool. So please, we're asking along with everyone else, get the money to us as soon as we can, or minimally release it, come to an agreement on at least the wages.
Thank you, Tracy. The bottom line is that providers have not seen a funding increase in more than a decade. And that's why we've been advocating for so long and so passionately for the kind of funding that was in the budget that was passed in June. And we are hoping that that's the beginning of an ongoing effort by the state to catch community nonprofits up to where they should be, funding that they need. Senator Kathy Austin, the Appropriations Committee Chair, was taking the budget out on the Senate floor, and she said she supported that she too was hoping that it was the beginning of a multi-year effort. And I think what you've heard today is frustration, a level of frustration that I've not heard from members in my time here at the Alliance. And it's because community nonprofits have finally gotten passage of a budget that had the kinds of increases that they've been needing for many, many years, more than a dozen years. They need those increases for the people that work for them. They need the increases for the people that depend on them for services, and they need it now. So thank you again for being here. We will take questions if you'd like. You can put questions in the chat box and we'll take them in the order they come.
Or you can just raise your hand or let us know if you have a question. So Ken, do you want to just ask it? You there?
Oh, yeah, sure. Yeah, just 4 basic questions. Basically, what are you hearing from Lamont's office about the holdup? How much money are we talking about for approximately how many organizations, Jean-Carl? And is it divided among wage hikes, fringe benefits, and retirement accounts? It's in the chat, so if you want to look over in there.
Yeah, in answer to your first question, we don't have a clear picture of why it is that the money isn't coming. We think it's because they might be trying to be very careful and not make any errors in their calculations. And, I'd say the state has many billions of dollars right now, and there's a cushion to fix it. So it's not a matter of saying it doesn't matter if they make mistakes. Of course it matters. But I would say that it's a crisis right now for nonprofits, or at least a near crisis, and it should be treated as such. We're talking about, on behalf of DDS providers, about $62 million in this fiscal year. For other private providers, about another $23 million. The DDS authorizations, allocations are for employees, for wages as agreed to in the settlement between the union and the Office of the Governor, and pensions and other benefits. Most of what's being made available to other private providers is also steered toward employees, but somewhat differently. Did I get to all of those?
And what's the ballpark number on organizations involved, Jean-Carl?
We have about 180 providers who are members of the Alliance. And those are most of the providers in the state.
And they're all in the same boat?
Yes. Yes.
Thanks.
Thank you.
Sue Haig.
Hi, everybody. It's Sue Haig with the Associated Press. I just get confused because there's so many different groups, but the group homes that they're facing, there's 2 of them that are facing strikes. You had talked, Tracy had spoken about not being able to settle contracts. Is this part of the same group at 1199 that's that you're trying to avoid a strike? And are any of you like in that position where you can't settle contracts and face the prospect of strikes?
Yes, Journey Found absolutely is. We have not received a strike notice. And there's no evidence of that as of yet. But we're in a position which differs a little bit from some of the other organizations. We had enough money in the wage allocation that was given us to absolutely give out our raises, and we made our proposal on July 15th, and we have yet to have the approval of the agreement of the union to move on it. And as I said, that's because the union wants agencies to sign up on the whole package. And we can't sign off on the healthcare and the retirement benefit until we know what our allocation is going to be from the state. And we won't know that until they've reviewed our application. And the close on that is October 6th. And they're going to have to review all applications after that point.
You worried at all that there could be a strike or that they may threaten one?
So sure, I believe, if they've done it with two of my colleague agencies, they could always do it here, here at Journey Found as well. And I'm in a similar position that they won't allow me to sign off and wait. And if they have not yet approached me directly with that request, but yeah, all of the unionized providers are obviously concerned about that. And it's against labor law for us to just go ahead and give the raises without their agreement. So we're in a bit of a bind.
Okay, thank you.
And can I just add to that, unionized or not, every single staff person working in one of these programs across the state of Connecticut deserves this money. And, strikes are dramatic. And as an organization that has 1199 and part of our workforce, we've been used to dealing with this over the years, but they should not be the way that staff are given increases or that organizations are funded to adequately provide services. I think it's really important we not mix these issues up. Every provider out there under contract with the state of Connecticut needs this money right now.
And when were you supposed to have received it?
It was effective July 1st, and over the years, I've been in my job a very long time. Over the years, the money has usually been forthcoming within the month of July, and state agencies have, we've been able to execute increases in our contracts almost immediately and go ahead and make decisions about compensation and wages. It's also generally been COLAs on the entire grant because there are other increases besides wages and benefits that need to get paid for that have now been frozen for a very long period of time. So this is really unprecedented in terms of the length of time it's taking to get money out, never mind in the middle of a pandemic and a hiring crisis.
So usually it's in July that you would get it. Okay. Thank you.
Yeah, Sue, just to clarify, they have gotten the funding the same level of funding that they would have last year. What they have not received so
Extra.
far, I think this is true for all of them, is the new increases that they need.
Right. Okay. Thank you.
Anybody else? Are we good? It looks like we are. All right, everybody, thank you very much for joining us. If you have any questions, you know how to find us.
Thank you.